About a third of adults will develop varicose veins at some stage in their life. The symptoms range from purely cosmetic, people not liking the way their legs look and feeling worried about wearing shorts or skirts in public, all the way through aching and discomfort and throbbing and swelling of the legs, to the later stages of vein disease where patients can develop a painful venous ulcer. Painful varicose veins can be treated just using compression stockings alone. Compression stockings, if worn regularly, do alleviate the aching and discomfort that patients have from their veins, but they don't fix the problem. The best treatment depends on the type and severity of veins that you're suffering from, and you should discuss the treatment options with your vein specialist. That's because there are several different types of treatment, and the best option will depend on a number of factors. These factors will include your general health, the size of the veins, the position of the veins on the leg, and the severity of the veins and whether or not they're causing skin damage. Until quite recently, the standard treatment for varicose veins was an operation called a high-tine strip. This involved a general anaesthetic, a cut in the groin, and stripping out of the main vein running down the inside of the leg with a plastic rod. About 10 years ago, the first minimally invasive treatments began to be developed for varicose veins. These include endovenous laser treatment, radiofrequency ablation, foam sclerotherapy, and the newer treatments such as Clarivane or the Safian glue system. All of these treatments have different advantages and disadvantages, but in the main, they're all superior to high-tine strip because they cause less pain and patients get back to normal much faster after surgery. In addition, most of them can be done under local anaesthetic. The advantage of seeking private sector treatment for vein surgery is that you're more likely to get the choice of the full range of options. The vast majority of vein surgery in the private sector in the United Kingdom is carried out using one or other of the minimally invasive techniques. The commonest minimally invasive techniques done in the UK at the moment are endovenous laser treatment or radiofrequency ablation. They both take about 30 minutes to perform. They're done under local anaesthetic, and patients who are particularly nervous can have light sedation or even be put to sleep if they prefer. If you are having laser treatment for your varicose veins, the surgeon will usually draw some marks on your legs before treatment. This is because when you're lying flat on the operating table, your veins will collapse and become invisible. Once in the operating theatre, the surgeon will use an ultrasound probe to guide the EVLT sheath into the leaky vein and position the tip in the correct place, usually at the top of the leg. The surgeon will then inject small amounts of anaesthetic around the vein all along its course. Saline solution is infused into the leg to compress the vein and to act as a layer of protection for surrounding structures such as nerves and skin for when the laser is activated. Once the catheter sheath is in the correct place, the laser is activated and the vein closes so that the blood will no longer flow through it. The laser and the sheath are slowly withdrawn down the vein, causing the full length to close behind it. The vein then becomes harmless fibrous tissue and is gradually absorbed by the body. EVLT treatment is more effective at obliterating the leaky long saphenous vein, which is the commonest cause of varicose veins. Endovenous laser treatment offers patients several advantages. It's minimally invasive. There are no large incisions or visible scars. There's a high success rate and a low recurrence compared to surgery. EVLT is an extremely safe procedure with a very low complication rate. There is minimal recovery time. Treatment time is well under an hour, and most patients are treated purely with local anaesthetic, with or without sedation, for people who are a bit nervous. During your initial consultation, your vein surgeon should discuss the risks and benefits involved in EVLT with you before you consent to treatment.